Welcome to our podcast channel, Urology for Everyone. This is Dr. Girish Nelivigi, Urologist and Andrologist speaking to you. In today's podcast episode, we are going to talk about a very common disorder that is seen in males, which is erectile dysfunction. Now, what is erectile dysfunction? It refers to a problem wherein the male is unable to start or sustain an erection for sexual intercourse. It is the most common sexual problem in the males. The male finds it difficult to get an erection despite adequate sexual stimulation, and also there is difficulty in sustaining or maintaining an erection. This makes it difficult to penetrate the vagina during intercourse. The causes of erectile dysfunction are many. In the young age, most of them are due to psychological causes. For example, it could be a work-related stress, finance-related stress, lack of privacy, relationship problem with the partner, etc. These problems lead to erection problems, and once the man fails to penetrate, he loses confidence. This leads to a vicious cycle of poor erection and loss of confidence, which worsens the already poor erections. He starts avoiding sexual intercourse, and this worsens the relationship between the partners. Unless this cycle is broken, the treatment is ineffective. Now, what happens during erection? Erection needs adequate blood supply to the penis. When a man is excited, the blood supply to the penis increases. However, the blood supply may not be adequate in many situations. For example, situations or conditions like diabetes, atherosclerosis, psychological problems, and other abnormalities of the artery and vein of the penis can lead to this. Apart from inadequacy of blood supply, nervous disorders like sensory neuropathy, as happens in diabetes, can result in erection problems. There could be decreased male hormone levels, also called as testosterone, which can cause this problem. Now, when you go to a urologist, he takes the basic history to assess the problem, does physical examination to see if there are no gross abnormalities in your genitalia, and some basic and also specialized tests. These include tests for diabetes, thyroid disorder, hormone assays like serum testosterone, Doppler scan of the penis to assess the blood flow adequacy. Once these are done, a treatment plan is checked out. Now, what are the drugs which help in erection and erectile dysfunction? Drugs which increase the blood flow to the penis are the mainstay of the treatment. Examples of these drugs are sildenafil, tadalafil, vardenafil, etc. These drugs are available widely and are used commonly. However, as they sometimes have cardiovascular side effects, they are available only on the prescription of specialists. These drugs should be taken as on-demand drugs only, which means that they should be taken about 1 hour before intercourse, and there is no need to take them if not needed. There are two strategies in taking them. One way is taking them for a short period of time till the time the person gets confidence and is able to get erections without the help of these drugs. After that, these drugs can be stopped. The second strategy is to take them as and when needed but on a permanent basis. This strategy is adopted when the person is old, has long-standing diabetes, hormone disorders, neuropathy, etc., which are not amenable to reversal. In any case, these drugs work very well because they are highly effective. In case these tablets fail to give the desired result, then the andrologist will advise the second line of treatment, which is injection of the drug directly into the penis. This is not as scary as one would think. Up to 1 ml of the drug is injected into the penis by the patient himself, or even his spouse can inject it. This is the same way a diabetic patient self-injects insulin. In fact, insulin syringe and the needle are used. So this causes very little pain and is more effective than oral tablets. If all these fail in treating erectile problem, then the patient may be advised to undergo penile prosthesis implantation. These are silicone rods which are implanted into the penis under anesthesia. These keep the penis in an erect state and enable penetration without compromising on the pleasure and fertility. The silicone prostheses come in two types, inflatable and semi-rigid. Inflatable implants are expensive but can be manipulated to flaccid and rigid states by pressing on a button which is under the skin of the scrotum. Semi-rigid ones give a permanent erection to the penis but are more popular in India as they're cheaper, easier to insert, and they have less complication because of lesser no joints. So I hope you have got some information about erectile dysfunction and the ways to treat it. Thank you.